25 arrested as activist protests proposed federal limits on gender-affirming care for trans youth. More than 50 activists gathered Tuesday in Washington, D.C., protesting proposed federal rules that would restrict access to gender-affirming care for transgender minors. The demonstration was organized by the Gender Liberation Movement, with participation from ACT UP New York and ACT UP Pittsburgh. Protesters assembled outside the Hubert H. Humphrey Building, headquarters of the U.S. Department of Health and Human Services. Activists blocked the building's entrance, held signs reading, quote, "Hands off our moans," end quote, and chanted in support of trans youth. Authorities say 25 people were arrested for blocking access to the building. Those individuals are now in the custody of D.C.'s Metropolitan Police Department. The protest coincided with the final day for public comment on the proposed rules. On the same day, 106 members of Congress sent a letter opposing the measures. The rules proposed in December 2025 by HHS Secretary Robert F. Kennedy Jr. would bar hospitals providing gender-affirming care to minors from participating in Medicare and Medicaid. They would also prohibit federal Medicaid and children's health insurance programs funds for covering such care and exclude gender dysphoria from protections under Section 504 of the Rehabilitation Act. I mean, look, protesting is not illegal. Let them do it. Granted, there are rules, so they got arrested. But, again, we keep looking at, all of these rules and regulations and laws and committee members saying, you shouldn't do this. And now if you're a hospital or a doctor giving affirming care, then the way this is reading, the hospital can't be in Medicare or Medicaid, which means you're not just punishing the 1%, you're now punishing an entire community in an area. So you're not doing harm to just one person. Now you're harming the full community. And I think other people need to start realizing that, I think a lot of people sit and go, oh, well, I don't know somebody who's trans, which they probably do, or that doesn't affect me. Well, but it does, because these rules open up floodgates, or they're written in such a vague way that it does affect you if they want it to.
Also, if they, besides the fact that this is horrendous and directly harming people, if they can decide one group of people can't get access to healthcare, what's to make them decide that they don't want to give healthcare to the Irish or to people in just the state of Connecticut? It gets down a very random, weirdo, wacko place, which is exactly what you would expect a guy like Robert Kennedy Jr. to do, because he's been running HHS like a crazy house.